What if I told you that your heart attack risk could already be coded into your DNA? And that no matter how healthy you look, your family history could silently be pushing you toward heart disease, starting your 30s or 40s. But here's the good news. You're not helpless. Let me explain. Heart disease runs in families, and not just from your parents. If your uncles, aunts, or grandparents had heart attacks in their 40s or 50s, your risk can go up by 2 to 5 times. Why? It's because of the inherited genes for high LDL, like familial hypercholesterolemia, which is a condition causing too much cholesterol in your blood, which can raise your risk of heart disease. It happens when a gene, usually one called LDLR, doesn't work properly, so the body can't remove bad cholesterol, LDL, from the blood. Even if you eat healthy, this condition can cause high cholesterol from a young age. This cholesterol starts to deposit in blood vessels, especially coronary arteries, leading up to narrowing and hence cardiovascular disease at 30s or 40s. The famous Framingham Heart Study found that if your dad had early heart disease before age 55, your own risk of heart disease goes up by 75%. If it was your mom before age 65, your risk goes up about 60%. Even having a sibling with heart disease raises your risk by 40%. It gets more serious with identical twins. If one dies of heart disease before age 75, the other's risk can go up as much as 15 times. Another big study showed that if both your parents had a heart attack before age 50, your risk of having one jumps more than 6 times. So, even if you live a healthy lifestyle, knowing your family history could be the key to protecting your heart. The other inherited condition is high blood pressure. Research from 2017 shows that high blood pressure, or hypertension, is influenced by a mix of genetics, environment, and lifestyle habits. Unlike some conditions caused by just 1 or 2 genes, familial hypertension can be linked to hundreds of genetic variations. A 2019 study involving over 750,000 people found that this complexity makes it tough to identify specific genes for targeted treatment. But it's not just about DNA. According to the CDC, your family environment also plays a big role. Being around smoking, even secondhand, can raise your blood pressure. A diet loaded with salt and unhealthy fats adds to the risk. And if a family doesn't prioritize exercise, quality sleep, or healthy habits, blood pressure can suffer as a result. Blood clotting issues are also inherited as well as insulin resistance. All these conditions, after getting inherited from parents, work silently in our bodies. Many don't realize they're at risk until a sudden heart event occurs. It's like carrying a time bomb without hearing the ticking sound.